Hello, everyone. Welcome to our ISIS Forum on Safeguarding Malaysian Workers and Households, Impacts and Avenues for Malaysia's Social Protection in COVID-19 and Beyond. I'm so sorry, we had a little bit of technical difficulties just now. We've just managed to clear that up. We have a good panel today. We have Prof. Norma Mansour, Dr. Amanina Abdul Rahman, and Dr. James Allen to speak on this topic today. So without further ado, may I, keeping in mind today is Friday, so we've got about one and a half hours for this discussion. So may I introduce Prof. Norma Mansour, our first speaker. Emeritus Prof. Dr. Norma Mansour is Director of Social Wellbeing Research Center, University Malaya. And Prof has had a long and distinguished career, starting at the Department of Administrative Studies at UM in 1985. Prof then has gone from strength to strength, heading the department in 2000, being Executive Director of the International Institute of Public Policy and Management from 2001 to 2004, Dean of the Faculty of Economics UM from 2004 to 2009, member of the National Economic Advisory Council under the PMO. Prof's areas of interest include social protection, aging, public policy, development, and governance, and she has published numerous books, chapters, articles in these areas. So Prof, please, I invite you to take it away, please.
Thank you very much, Terence. Assalamualaikum and a very good morning to distinguished panelists and also participants. Allow me to share the screen. Yeah. Okay, all right. Yeah, is it working? Yes. Now I have, I will start my comments with two areas, on the rationale for a stronger social protection for Malaysia. And the second part of my presentation will be on the suggestions that going forward, what should we do? And there are four main reasons or main points that I would like to highlight with regards to social protection, and especially this was made, it further exposed the type and the social protection that, or the lack of it, that we have in the country with COVID-19 pandemic. Yeah. So these four main points is about inequality, it is about aging, and these are the two factors that most people talked about. But it is also the other aspects or the other elements of social protection. Now, social protection is just essentially means on how society protects its people or its members against any crisis. Yeah. So it can be an economic crisis, it can be a health crisis, it can be when you are aging. Yeah. So someone who's working and when they retire, the income may not be sufficient for them to maintain their livelihood. And the aspects of social protection is about not just protecting, we're familiar with protecting, but it is also about prevention, as I mentioned earlier, preventing individuals from falling into poverty. Yeah. So COVID-19 has shown us that even if you have jobs, especially in tourism, in the airline industry, you may be middle income, and but without a job, you will be part of the lower income within few months. Yeah, may not be immediately. But the other aspect of social protection is also about promotion. It's about providing opportunity for everyone in the society to improve their lives, to move up the quality of life. Yeah. So, so for Malaysia, we are caught in this middle income trap. So we have issues with why we are not moving up the development ladder. Yeah, and the digitalization and technology is pose a challenge for Malaysia as well, because we are getting more and more are on digital platforms, and with the industry 4.0 automation will happen, etc. There will be an increase in unemployment, and also the informality of jobs. More people will be on the digital platform or having businesses using digitalization, therefore they don't belong to any formal organization, hence they are out of the formal social protection system. So ISIS theme today that you are covering both workers and households is very apt, because we have to look at how we should protect everyone, not just workers, not just employees. Yeah. So in the past, our social protection had been about, or is very much employment based. So now, as many other countries, as they progress in their development stages, they too look into protecting the whole society. Yeah. So, okay, the first point is on the inequality. As I mentioned earlier, inequality in Malaysia did not improve. So social protection is seen as a tool to address poverty. Yes, that's one aspect of it. But on the other hand, the taxes, how we tax the higher income or people with better living, and support the low income, or the distributive aspect of the taxes, is supposed to correct the inequality, because then you will have transfers, you will have assistance, or whatever measures that you have to support the lower income would enable you to close that gap, which is reflected in the Gini coefficient. And for Malaysia, if we were to compare with other countries, as I have on these slides, shows that the change or the improvement in our inequality is very minimal, from 0.43 to 0.41. Whereas in some other countries, it reduced by about 20%, 30%, and some even 40%. Yeah, so you talk about the Scandinavian countries and all that. So the issue here is either we don't tax our rich enough, or our tax revenue is very small. Either tax can be direct taxes or indirect taxes, or we don't give the lower income enough for us to correct this inequality. So my next slide shows that we look at the social expenditure for Malaysia. So compared to other countries, yeah, Malaysia's social expenditure as a percentage to GDP is notably lower than the high income and upper middle income countries. So we are in the upper middle income country bracket. Yeah, and yet our social protection is lower compared to these countries. We are among ASEAN countries. We are comparable to Thailand and Singapore, marginally lower than Singapore and Vietnam. So so we will have, as a society, as a nation, we'll have to look into this. And our issue, as I mentioned earlier, is also on the revenue side. Yeah. So tax to GDP ratio, yeah, the figure that I had was 2018 was 12.5%. And the year when we had the GST, it was about 13.5%, whereas the average OECD is about 34%. So, and I have here also the different components of taxes and how they are spread out to make up for the 12.5%. So we still have room for improvement, but then again, like yesterday when we had our Malaysian Economic Association in conversation as well about the economy, some decisions is very difficult to take. So sometimes governments take an easier way out. There is a need for a strong political will in order to do certain things or introduce certain policies that may be unpopular among certain groups. Now, the other rationale that I mentioned about is our demographic shift. The window of opportunity of our first demographic change is coming to an end. And if we did not save enough, from our surplus, from the high growth that we had, then when the working age, 15 to 59 in our case, begin to descend after 2020, the old age dependency burden will be bigger, which means that we have to work harder in order to support our old age population. And this is happening already. So, but it's not too late, because we have an avenue for the second demographic dividend if our policies are right. Our policies in terms of our investment, our savings, if they are right, then we can still benefit from the second demographic dividend. I have a paper on this based on the Malaysia Aging Retirement Survey data. Now, what are the issues that we have in the country? Not that we do not have social protection in the country, we have. However, it's very biased. Yeah, it's biased towards the poor, the very poor. So we have the poverty targeted programs, about 200 of them. This was 121 when we were working on this. But the last workshop that the ministry had coordinated showed that we have about 200 programs under 22 ministries. But they are fragmented, they are not coordinated, and the coverage is very low. The amount of the benefit is very low. So we have those issues as well. Now, so far, if we look at the past plans, the past Malaysia plans, we can see that there is a people focus, or there are emphasis on improving the lives of Malaysians. People was at the main planning objective. However, our approach has been about welfare. It's about charity. It's about helping the poor. We forget that social protection, it is also about other things. Yeah, it is also about developing human capital. So it is a development strategy. That's how we should look at social protection. Now, the other component, the other group that we cover very well is the formal sector. Yeah, the EPF, the SOCSO, the LTAT. But the in-between, yeah, so the in-between, people with unstable form of wages, which can be found in the formal sector as well. Although in the last budget, there have been efforts, and SOCSO and EPF too have been introducing some of these voluntary contributions, but the traction is very small. It doesn't cover majority of our people. Now, how big is this group in the formal sector? Now, from EPF data, okay, let's talk about the ages 15 to 64 or 15 to 59. There are 22 million Malaysians altogether in that category. So we have 1.6 million in the public sector, and we have another 1.5 million in tertiary education. So, and we have put 4.4 million. EPF has 14 million contributors, but 4.5 million is the active members. So you have about 60% of the Malaysian population that's not covered. So this gap is our big problem. I'm coming to my suggestions. My suggestions are that we use the life cycle approach to benefit the vulnerable categories. I have it in my next slide. Simply because my earlier four points that I talked about, how the middle income trap, if we do not encourage people to innovate, and innovation has risks with it. And they have nothing to fall back to. If there's no social protection, they will not take risk. And if we don't innovate, we cannot get the productivity that we want in the country. So unless we correct the security aspect of our people, we will not, individuals, companies will not be able to move up, or will not be able to improve and further increase productivity. Yeah, so I'm trying to write my point here. Yeah, and going for, rather than targeting the poor, because we're going to have a lot of issues. I know that you'll be asking about the informal sector, the Majid Kia and the likes, and someone from Beluran, Saba, etc. So my suggestion is targeting the life cycle, going for the phases of vulnerability, which I will show in the next slides, would be a way to go for Malaysia. It's not going to be easy. And to mandate all adult Malaysians to contribute to a fund, similar to EPF, SOCSO, and the likes. And the moment they start work, they should contribute to a fund. You can call it social solidarity fund. You can call it solidarity fund, or any fund for that matter. You can call wakaf. Yeah. And for the low income, the government can contribute on their behalf. The reason why we need this kind of fund, as opposed to coming from the tax, if we are not working from the revenue side, as I was saying earlier, is that it will be the SOCSO type, the QUAP-like type, or the EPF-like, where you invest the fund and there is an element of cross-subsidization, meaning that the fund will become bigger because for the higher income, they will save more. And it is the return from that investment that you will use to pay the benefits when in times of crisis, such as this. So you can imagine pre-2018, we did not have the employment insurance system. And when in 1997, when crisis hit us, we had to support bailout companies because we want people to be employed. Whereas South Korea had reformed their social protection so they can let a free fall as far as the economy is concerned. So now with the EIS, at least the government do not have to support those in the formal sector because they can draw down the contributions they have made in the past. Yeah, and my third suggestion is to enable a single window entry for all social protection benefits. And in this case, is what we have now is everyone will have to go, or when you start work, you will have to go to the EPF, you have to go to SOCSO, you have to go to LHDN, etc. So what I'm proposing is that if we have one single window, then you just go and register one, either at LHDN or at SOCSO, then you are registered for the other social protection. Yeah. And my last point is on using my card to benefits the entitled categories, the way we use the existing healthcare system. I will share with you the next slide that shows that this is the way that I would see an integrated social protection system for Malaysia, where at the lowest, the coverage, yeah, remember social protection will have to take into consideration three main elements: coverage, adequacy, and cost. Yeah. So if you want to cover, if we are suggesting that cover every Malaysian, so you have the child grant, yeah, as children at the working age, we will have the social security, yeah, the QUAP, the SOCSO, and the likes, and the post-working age for the social pension. For those higher income, so for this level, you get tax funded, a small portion of it, and a bigger portion will come from the contribution. And for those higher income individuals or Malaysians will be able to draw down from their either their EPF or their SOCSO. Yeah. So it depends on what is the appetite for cost for Malaysia. If we are concerned with our fiscal deficit, then it can be a smaller amount at the lowest level, and we can also test and remove the rich 20%, 30%, or 40% using the administrative data that we have been using already for the Prihatin package. Yeah, and as I mentioned, we have to ask ourselves, yeah, when the government or as a society, we want a stronger social protection. We have to ask ourselves whether do we want to cover everyone? Yeah. As of now, the way we cover our social protection is targeting the poor, but also we target households. Whereas what I'm suggesting here is to target individuals. So you can be an informal sector, you can be self-employed, but you are part of the whole group or the net that is covered. Yeah. So if you want to cover everyone, then perhaps if finance fiscal is an issue, then the amount cannot be very high. Yeah. So currently, for instance, some bantuan that we are giving is 350, it's going to be raised to 400. If you want to raise to 1,000, you can, but perhaps if you do not want to balloon the cost, then you can bring it, you can give to less people, but is that what we want? So these are the questions that we have to ask ourselves. So all three objectives cannot be, they are conflicting, it cannot be achieved, but 2 out of 3 can be done. Yeah. So with that, thank you very much, Terence, for giving me the opportunity.
Thank you so much, Prof. And certainly a very insightful and interesting presentation, covering sort of the key goals or objectives of social protection, address poverty, inequality, and sort of quality of life and the ability to sort of continue your livelihood throughout the age. Also in terms of tax and transfers and the situation in Malaysia, and also some very interesting proposals in terms of quality, coverage, and I'm sorry, I didn't write down the last one. And also mentioning sort of some of the reforms in South Korea. Maybe might have a question on that a bit later, and see the potential of implementing some of those reforms in Malaysia. If I may now move to the second speaker, and I'm just going to use my prerogative as chair of this session. If we may dive a bit deeper first and invite Dr. James Allen, senior lecturer from UMS Saba, to provide some perspectives from especially East Malaysia, being based in Saba. And then the last speaker will then go to Dr. Amanina, who will then provide sort of this global perspective and what is going on around the world and how it relates to Malaysia. So if I can introduce Dr. James Allen, senior lecturer at UMS Saba, Faculty of Business and Economics. He specializes in human resource and labor economics, and also I can see some natural resource management as well. So please, Dr. James, the floor is yours, about 10 to 15 minutes.
Good morning, everyone. You can hear me? Thank you, ISIS, for inviting me. So I suppose Prof. Norma actually covered the topic, almost all aspects of it, but I would like to talk about what's happening in Sabah. We are far away from Peninsular Malaysia, far away from Putrajaya, okay? Okay, I think I will start with our situation under COVID. So I will restrict my talk from the time of MCO, the lockdown, until countdown, end of this year. And maybe if I have time, maybe beyond that. As you maybe know, we are actually having a new government. This new government is only in power about the last quarter of this year. And they already actually tabled the budget, state budget. And the state budget is not big, about 20 billion, plus 5 billion from federal allocation. And they, if you look at their budget, I don't go into detail, they actually focus on to revive the economy and to jumpstart, because our economy is very slow now, although we are in the recovery, but it's slow and steady, I'd say. But, and so they focus on service sector like tourism and our primary commodity like agriculture. So this, and the most important is they actually spend a lot of resources and time for damage control, because in the previous government, which lost in September this year, they actually done a lot of damage to the economy. Let me mention that Warisan Plus government actually implemented policy U10 that actually destroy jobs. Number one is they actually impose ban on export of saw logs and sawn timber, surround timber. That's about 30% from the tree that we cut here. So they banned that. That cost about 7,000 people to lose job. And then in the early 2019, actually they terminated contracts of to manage water treatment plants, and this actually destroy about almost 2,000 jobs, decent jobs, and also they implemented through the local authorities not issuing license for slot machine. Maybe those of you who doesn't know what slot machine is, actually is we call it jackpot. It's a machine you put tokens or coins and you see the fruits coming. So that simple U10 in policy at the state level actually cost about 2,000 jobs again. And if you look at statistic, as for September 2020, we have about 120,000 people unemployed here. MCO alone cost 5,000 people to lose a job. So that means if you talk about social protection for workers, and these are the people actually need a lot of support at the moment. So I don't know actually how many of them actually already apply and receiving what we call the SOCSO unemployment benefit, the one introduced in 2018. But that one is based on contribution. If you didn't contribute, you have nothing to withdraw, just like Professor Norma mentioned earlier. The same as EPF. If you just started working, your account one is zero. Nothing much to withdraw. Don't talk about condition that you have to fulfill. There's a lot of bureaucratic red tapes in there. If you go to what you call that EIS, employment insurance, is it? Malaysian insurance, employment insurance, yes. If you are unemployed already and you try to figure out how to apply and how to go about it, you have more stress actually. And because that is one side of that problem. Another side is, while the number of people unemployed is increasing and counting at this very moment, the number of job vacancies actually is shrinking and small. Okay, let me quote the number. Until September this year, the unemployment 120,000 people. Job vacancy is only about 80,000 according to the previous government, but statistic department disagree. They say it's only 15,000 jobs available. So you imagine the number of people looking for a job is double than the job available vacancy. So what you do with those people who really cannot find a job because there's no job for them? So government say, both federal and the state level say, okay, we take them out from the market for temporary and retrain them. Okay, so you pay them allowance 6 months maximum, blah blah blah. But the thing is, it's not only people who is unemployed we should think about, but also household. I mean, these people are not just individual; they consist of household. And if you look at basic statistic, they say people in Saba actually the spending actually is less than the income monthly. I say household mean household income actually is more than the expenditure. That is actually is misleading because you think about it this way. Okay, our GDP per capita is about 12,000 ringgit. Okay, sorry, our GDP per capita is 25,000 ringgit, about that. Okay, that means translate into monthly, that will be about 2,000 ringgit per people who live in Sabah. Okay, 2,000. And our expenditure is more than way beyond that. So, and we don't talk about rural and urban difference between expenditure and income. So definitely here we have a lot of people vulnerable at this moment because of the restriction of movement, because the economy is slowly but steady picking up, and it will take some time for that whatever G spending that I mentioned earlier to maybe take effect in terms of multiplier income or employment. But we cannot wait for that, okay? Because the best protection, social or income or economic protection actually is when people actually is working, never mind about if the salary is not that much. But the point is they have to work, and they cannot work if there is not enough job. So we are back to that formula that government need to actually, oh yeah, I mentioned about the state government actually running budget surplus, which is good in terms of fiscal prudence because they're not spending more than what they can. But at the same time, if you are Keynesian, you think that that's not good. They should actually be more adventurous and spend a bit more because these are the time we have to spend. At the individual level, as already discussed just now, people actually tend not to spend. They tend to become more frugal in difficult time now, especially when job is not plenty and people are losing job. We are actually, I think, I want to end from here. I want to say one thing is that we are no longer in recession. I think here, yeah, I'm not talking about Malaysia because Malaysia is full employment, although people forecast our unemployment rate is 7%, but it's not far from full employment. That is about 4%, they say. But Sabah is moving away from Nairu, moving away from that 4%. We have higher and higher. And so I would say that we are more than in recession. We are about to go much way dangerous than that, okay? Hopefully not. They say, someone asked me about the difference between recession and depression. They say recession when your neighbor lose job, and depression in when you lose your own job. So that's the situation now. Yeah. Do I have a time or just nice?
Actually, just nice, and perhaps you can follow up on some of the points
Okay.
in the Q&A. So thank you very much, Dr. James. Certainly some very concerning points, especially with regard to Saba. Of course, the dangers of slipping into a severe recession or possibly worse. And also, sort of your points, the new budget passed by the new government, which focuses on primary commodities and service sectors, which are important to Saba. Issue of, really large and rising numbers of unemployed persons, and not many job vacancies compared to that. And also your point about looking at households as a unit versus individuals, where the current situation doesn't fully capture the true scope of household expenditures versus income. So certainly a lot to think about, because we have sometimes a tendency, not intentional usually, but focusing on Peninsula because of course Parliament, Kuala Lumpur is the capital, and policies made in KL. But it's also very important to look at Malaysia as a whole, including Sabah and Sarawak, and really have policies that address all of the issues of the nation. And with that, let me turn the floor to Dr. Amanina, economist at World Bank Malaysia, to give us her views on the situation here, and also maybe some insights from the rest of the world. Dr. Amanina Abdul Rahman is an economist in the social protection and jobs global practice at the World Bank. In this role, she engages in policy dialogue with the Malaysian government in the areas of jobs, labor markets, migration, and social protection. Prior to joining the World Bank, she's completed a PhD in economics at Monash University, where she taught econs and statistics. And she's also been a visiting researcher at Erasmus University, Rotterdam. So Dr. Amanina, the floor is yours.
Thank you very much, Terence, and thank you, ISIS, for organizing this session today and for having me here. Can I share my screen? Would that be possible?
Yes.
Yeah,
yes.
Thank you. I think someone on the ISIS side will have to allow me to do that. But so we can start anyway.
Yes, please do. You should be able to do it now.
I should be able to. Okay, let's do that. Sorry. Okay, I think you should be able to see my screen now.
Yes, perfect.
Okay. All right. Okay, thank you. And so, sorry for the technical difficulties. Right. So just to jump into it, the focus of my presentation today will be on the existing gaps in social protection, some of the short-term impacts of these gaps, as well as actionable steps forward Malaysia can take to invest in building a better social protection system for the future. But of course, I will also welcome very much questions on the a little bit more on the international scenario after my presentation. So to that end, there will be 3 parts to my presentation. The first part will, The first part will provide an overview of Malaysia's social protection system, and I will also be briefly discussing its performance and how it compares to that of other countries. Before talking about COVID response, I do think it's worthwhile to take stock of the social protection system as it is this system that has provided the foundation to our responses to COVID. Even if you look at Budget 2021, it has proposed some adjustments on existing programs with the objective of increasing support in light of COVID. And so after giving you an overview of Malaysia's social protection system, I will briefly touch on Malaysia's response to COVID-19 and share some reflections. And finally, I will touch on some of the ways that Malaysia can strengthen its social protection system. So to start, I would like to share this stylized framework for an enhanced social protection system. And this framework was designed in view of the changing nature of work, first brought about by rapid technological advancement in the advent of IR 4.0. And what we see during this crisis is that it has actually made the need for an enhanced social protection system even more pertinent, as it has accelerated some of these changes in the nature of work that were already underway prior to the crisis, including increased automation and digitalization. So if you look at the enhanced social protection system, it has 4 layers. The first, or the innermost layer of protection, would largely comprise non-contributory social assistance programs, such as cash transfer programs like Bantuan Sara Hidup or Bantuan Prihatin Rakyat, or the cash transfer programs by the Department of Social Welfare. This layer would also include any publicly financed premium subsidies for those who voluntarily participate in contributory social insurance schemes, such as matching grants for voluntary pension contributions. And I will talk a little bit more about all of this a little bit later. But in principle, the guaranteed minimum of this layer would be available for all of those in need, set at adequate benefit levels. It would also incentivize work, be responsive to changing circumstances, and be fiscally sustainable. So the second layer of this framework would consist of mandatory contributory social insurance programs, such as mandatory old age pension schemes like the EPF. Ideally, it should not depend fully on participation in formal wage employment. It should be combined with a guaranteed minimum to ensure an adequate level of protection for all. In the third and fourth outer layers, additional insurance is achievable through voluntary saving schemes supported by government incentives and nudges, and by unincentivized savings for those who can afford it. So this framework gives us a way to really think about the social protection system as a whole. But if we move on to the Malaysian context, Malaysia is still some way from developing an enhanced social protection system, but it does implement various social protection programs. And by that, we refer to 3 groups of programs. The first being social assistance programs. And this includes all of the transfers, like the Bantuan Sara Hidup, previously BRIM. As I mentioned earlier, it also includes transfers by Department of Social Welfare or Jabatan Kebajikan Masyarakat, and all of the other cash transfer programs. Prof. Norma mentioned earlier that there really are many programs, more than 200 programs implemented by over 20 ministries. So all of this, most of this would fall under social assistance programs. The second type of social protection programs are social insurance programs. And as I mentioned earlier, this includes EPF. It also includes public sector pensions, the LTAT or the military pensions. And this also includes voluntary supplementary pensions, such as those by the private retirement schemes. This also includes SOCSO. And finally, the third type of programs are labor market programs, and these are intended to promote productive employment. And in Malaysia, this includes skills building programs, including those that are coordinated by HRDF, and it also includes employment services by EIS. If you look at the whole system, the Malaysian Social Protection Council provides overall coordination of these programs, and in these programs rely on delivery systems for assessment, enrollment, provision, monitoring, and management. So if you look at the social assistance system, our analysis suggests that Malaysia's social assistance system has some way to go to providing a guaranteed minimum of protection to all of those in need. The coverage of social assistance in Malaysia is broad, with about 76% of all households and 98.2% of all B20 households in Malaysia receiving some form of social assistance. This is far higher than seen in other countries, including upper middle income countries and high income countries. However, the depth or the benefit level of social assistance in Malaysia is low. And if you calculate the level of social assistance benefits as a share of per capita income, social assistance only constitutes about 3% of income for all Malaysians. And for the B20, who are most in need, the adequacy of social assistance is slightly higher at 7.8%, but it's still far lower than the adequacy of social assistance benefits in other countries. Because of this, the social assistance system really has very modest impacts on poverty and inequality. And Prof. Norma talked about this a little bit in her presentation earlier. But if you look at the graph on the left-hand side, it shows that the reduction in inequality and the reduction in the poverty head count resulting from social assistance is slightly higher in Malaysia compared to other upper middle income countries. However, the reduction in the poverty gap is lower in comparison. And the performance of social assistance the performance of the social assistance system in Malaysia is also behind that in the aspirational high-income countries. If you look now to the graph on the right-hand side, it shows that the performance of the different components of the social assistance system in Malaysia are very different. BSH, which next year will be replaced by BPR, has a relatively high benefit level compared to the social assistance programs implemented by JKM, and therefore has a greater impact on the reduction of the poverty gap. However, because the JKM programs reach the most vulnerable compared to the BSH, which covers about 60% of Malaysians, the reduction in the aggregate poverty gap obtained from each ringgit spent on the program is slightly higher than seen for BSH. In other words, even though the benefit levels are lower for the JKM programs, the sharper targeting of these programs means that every ringgit spent on these programs have a greater impact on the most vulnerable. If we move on now to the second component of social protection, which is social insurance. One of our main findings is that the coverage and adequacy of long-term savings arrangements need to be improved. And if we look at the share of the labor force covered by retirement savings institutions, which in Malaysia's case includes EPF as well as QAP and the LTAP for the armed forces, we find that about 60% of Malaysia's labor force is covered. In this places Malaysia almost at par with other countries with a comparable GDP level. And the graph shows that Malaysia is just slightly below the trend line. However, if you're using 2019 data, the graph on the right shows that the majority of retirees will actually receive very low benefits in retirement from their EPF accounts. Over half of members at age 54, using data at that time, had balances of under 150,000, and almost 3/4 had balances of under 250,000. And if we translate this into an indexed annuity, or the amount of EPF savings that are available to members per month for the remainder of their lifetime, almost 3/4 of workers retiring with active EPF accounts will have a monthly benefit of less than 1,050 ringgit. And an important point to mention at this point is that this analysis, again, is based on data from 2019, before the provisions to EPF were made in light of COVID. And so both of the measures introduced, low contribution rates and early withdrawals, would affect future account balances at age 54. So if we look now to labor market programs, we find that there is duplication and fragmentation in Malaysia's labor market programs. Malaysia's labor market programs involve a wide range of ministries and agencies, with up to 11 ministries involved in the implementation of skills building initiatives alone. So this large number makes it difficult to obtain accurate data on spending and on the effectiveness of labor market programs. At the same time, the fragmentation of programs results in smaller level of spending and a reduced number of beneficiaries for each program. And they make these programs costly to administer and inefficient. For beneficiaries, the multiplicity or the fact that there are so many programs implementing agencies can also be confusing and creates high transaction costs. However, we do commend recent efforts to reduce fragmentation in Malaysia's labor market programs, with the EIS employment portal, My Future Jobs, having been named as the central employment portal. And in the future, we hope that this will lead to less fragmentation. So moving on now to Malaysia's COVID-19 response. Malaysia's COVID-19 response has encompassed all elements of social protection. So most of us may know this already, but just to quickly go through it. In terms of social assistance, there's Bantuan Prihatin Nasional, or BPN, and this has covered both the B40 and the M40, which is very welcome given how hard the crisis has hit everyone. Enrollment to this BPN was also very easy, and existing beneficiaries of BSH were automatically enrolled. People who have filed a tax return were also automatically enrolled if they met the income threshold. And right now, the second round of disbursement for the second round of BPN, or BPN 2.0, is scheduled for January. And we are glad that there has been a second round. However, depending on the progress of economic recovery, further transfers may be needed, perhaps for a smaller group of beneficiaries who are most in need, such as the B40, just keeping the expenditure side of the equation in mind. If we look at the social insurance response, allowing for early withdrawal of EPF, as well as the reduced contributions, has both advantages and drawbacks. It can alleviate the burden of households and prop up domestic demand during the crisis, and we think it has. However, it also affects Malaysians' income security at retirement. Moreover, it should also be noted that many of the B40 do not have EPF accounts or have very low balances, and so they would not have been able to benefit from this. The M40 are more likely to have benefited from this. Finally, if we look at the labor market, there are several steps that have been taken to support the labor market during this crisis, and this includes wage subsidies, training incentives, and the budget 2021 also announced various measures as part of the Jana Kerja initiative. This represents steps in the right direction. So we think that they moved towards promoting job retention earlier in the crisis, and now they are aimed at job promotion and promotes upskilling and reskilling, employment and re-employment, which will be very important for Malaysia moving forward. However, the effectiveness of these programs remain to be seen, and they should be monitored so that we can learn from it and look at how we can improve these programs in the future. So now that we have taken stock of some of the main elements of Malaysia's social protection systems, I would like to share with you some of our recommendations on the way forward for Malaysia. So we expect that the need to protect the welfare and livelihoods of the B40 during this crisis still remains. And in this context, further rounds of cash transfers may be needed to further provide short-term relief, to mitigate financial strains, to support medium-term recovery efforts, and to support consumption and human capital development at a time of crisis. And as mentioned earlier, it will be worthwhile to consider really channeling any further rounds of cash transfers to a more limited group of beneficiaries compared to the broad group initially covered by BTN. And this is to ensure that a greater share of transfers go to people who are most in need. Over the medium and long term, social assistance policies that are appropriate to the new normal could be strengthened to protect all those in need in line with the enhanced social protection framework shown earlier. Acknowledging that an enhanced social protection system will need to be financed, there is also a need to reverse downward trend in government revenues and move toward a broader and more progressive tax framework. And concerning social insurance, several measures could be implemented to increase the proportion of workers actively contributing to EPF. For instance, the self-employed could either be required to contribute or be governed by a default option whereby all are registered automatically but can opt out during the first month of employment. In addition, cooperation with industry associations and other aggregators such as gig economy platforms can further be encouraged and strengthened. There has been some move towards this, and we commend that, but we think that this can be further strengthened. At the same time, there may also need to be a consideration of increasing the contribution histories for those who are active EPF members to ensure that retirement savings could be sustained for a longer period of time. And two measures seem to be particularly crucial. First, the minimum withdrawal age for EPF account 1 could be gradually increased from 55 to 65, perhaps over a 20-year period. So this would be a very slow change. And what would happen is that it would increase accumulated balances and create incentives for individuals to work longer. And second, consideration could be given to converting contributions to EPF account 2 to pure retirement savings. Strengthening coverage and adequacy of balances will be especially important after recovery from the crisis, given the provisions that have been made to weather this crisis. Nevertheless, even with these measures, it is unlikely that EPF can ever reach full coverage of the labor force. Therefore, we also recommend to introduce a modest, broadly targeted, and publicly financed social pension. And one practical option would be to introduce a relatively modest social pension of the same benefit level as the current Bantuan Orang Tua program, targeted at the B40 age 65 and above. Fiscal space permitting, coverage or adequacy of this social pension can be expanded over time. And with that, I end my presentation and I look forward to the discussion. Thank you.
Thank you very much, Dr. Amin. For a very good presentation, giving us an overview the structure of social protection systems in Malaysia. And also from your slides, I can also pick up this sort of continuum from sort of assistance to insurance to labor market sort of measures there in terms of training, etc. And also for your suggestions on the way forward. Takes my mind a little bit to process it, so I won't try and summarize it here. But maybe let me just open it to questions. We have about 20 to 30 minutes for Q&A. And maybe what I'll do first is invite Kelvin, because I don't see the actual questions, but I see we have 2 questions in the Q&A. And I invite Kelvin to read out one of those first.
Okay, thank you, Terence. So we have currently 4 questions in the Q&A tab. I'll maybe read out 2. So one question from Muhammad Daniel asks about developed countries like Germany has initiated universal basic income as part of its unconditional social protection to the people. However, this program would end up with a massive fiscal implication. And Muhammad Daniel asks if in the Malaysian context, given our current fiscal conditions, would it be possible for Malaysia to pursue more universal style transfer? And a second question I'll read out is directed to Dr. James from Ainun. Ainun asked, could Dr. James share with us what are the social protection programs available in Sabah state specifically, and what are the areas that need to be improved in the existing social protection programs so as the impact of COVID-19 could be minimized, maybe to Sabah state specifically?
Right. The first question, can I open it to anyone in the panel, Prof. or Dr. Amanina or James? Maybe who wants to go first? Maybe Prof. first. Yeah.
Okay, I can go first. Thank you, Muhammad Dania. Yeah, universal basic income is a big discussion. Yeah, especially for a country like Malaysia. But if you go by the ILO Convention 202, ensuring that income for older persons is one of the, you talk about the social protection floor, is one of the areas that we can look at, yeah? Now, another concept that was raised in this question is the concept of universality versus targeting, yeah? So what I was proposing earlier too, it was about you go by categories, yeah? And because of the IC, the My Card, which has the potential to store information and also for us to deliver any cash transfers. So hence my proposal for the use of My Card. And also all the programs that we have now is one has to register, is self-registration. Yeah? So someone in Balongan, Sabah, for instance, will not have the internet, or the JKM officers or whatever may not reach some of these parts, and for them to access for the fund, they will have to go 100 kilometers to get to the closest BSN or to the closest bank. Yeah? So our issue now with the present system, which is poverty targeting, yeah, and one will have to register, yeah, has a lot of issues in there because not everyone will be able to register, especially if that person is so far away, and if they are illiterate, they don't have an internet, so that is problematic. Now the second point is about how verification is done. The eKasih database has a big backlog, about 70,000 cases that have not been investigated. Now, Global evidence shows that for those targeted programs, the investment or the cost of the administration is about 11 to 30%. And so this is the cost for the administration, which could have easily been given to those who need it. And the other aspect about this is the issue of exclusion because of the difficulty, as I mentioned, or the challenges for the furthest and the poorest and the most illiterate to access and to register. The issue of exclusion is about 30%. That is evidence in other countries. And the issue of inclusion, because you have to remember that all this bantuan that's given out is based on household income. It's based on household. Whereas what I was proposing is for individuals at every category, the vulnerable categories in their lives, to children, to maternity, to those who are in the employment category but lose their employment, and for older persons, for old age pension, as Amanina mentioned. So, and when you go with households, yes, you will get a big number because you multiply by 3.9 or by 4 because of the household. But each household may have 2 children with parents, 2 more, so it's 4. And some household will have 7 children, and yet they receive the same 1,500 ringgit or whatever amount that you mentioned. So we have bigger challenges, we have bigger issues here before we can discuss about the universal basic income. So I will stop there for now, Terence.
Thank you, Prof. Maybe I move to Dr. Amanina. Do you have any responses?
Sure. No, Prof. Norma made very great points. While I'm not going to talk so much about what Malaysia can or cannot afford, I think what we can agree on is that universal basic income will be expensive. That's something that we know, and that's what the commenter Daniel also mentioned. And so that's why we in recommending a social pension, we also suggest starting with the B40 and at a very low amount, just to start with, and then to gradually expand that when fiscal space allows it. And I think that's a sensible way to go. We start with the most vulnerable, but within that category we give to everyone. And just to maybe dive a little bit deeper on the issues of targeting that Prof. Norma mentioned, in our analysis, what we actually found is that a significant share of the B20 are not receiving any support, and these are people who need it the most, and there are many challenges to getting them to enroll for these programs, and so some form of automatic enrollment would be very much appreciated, although this has to be very well thought through, because these may be the same people who, as Prof. Norma mentioned, would be more inclined to visit a physical branch of a bank rather than receiving digital transfers. So I just, I don't think I have an answer to this difficult question, but rather to say that there are a lot of things to think about, whether Malaysia can afford it, how we are going to reach the most vulnerable first, and how to make sure public spending is as efficient as it possibly can be. Those are the things I would like to highlight.
Thank you. And yeah, certainly the issues about reaching the most vulnerable, especially in remote and areas or other issues of accessibility. Let me then segue into Dr. James. Maybe your thoughts on this issue, and also if you can then segue into the next question asked about the what social protection programs are there in Saba, and what additional programs can be implemented. Dr. James, please.
Okay, thank you, Ms. Ainun, for that questions. When you ask about social protection in Sabah, from the federal government, actually it's the same as what you have in Peninsula or Sarawak. For example, we have a welfare department that actually we have both federal and also state, and the state actually is giving away 300 ringgit one-off payment for people below PLI, 1,200, below 1,200 maybe. And like Dato Norma mentioned just now, the situation in Sabah is slightly severe because of infrastructure, the distance, and many people living in isolated and remote area actually have no access to technology, the one that we have. So actually they actually start struggling with to make end meet to survive. Don't talk about having internet. They don't even have a phone. One of my students actually had to climb tree, as you know, just to get coverage so that she can finish her homework. And she received a lot of publicity. I thought her life will be better. No, I asked. She said, no, I went back and I have to go and camp out again in the bush. So that's a simple anecdotal evidence. Of course, it's not representing the entire population here, but it tells us a lot of the magnitude of stress people under. And social protection, actually, right after the MCO, that in June, I went to field work to an area called Tenom, where people of Murut ethnic lives, and they have no good roads. It takes about 3 hours to just reach their village. And there's about 2,000 of them living inside the jungle, inside the forest reserve. And during MCO, of course, there is a restriction on movement. So they have no way to sell their produce. For example, coffee, they produce very good coffee. And so the state government, I'm talking about at the state level, they have to do a lot of things for just to allow them to go to the town and sell the produce. Every time people say something how hard their life is, government say, hey, we have a lot of aid, relief aid. It's your fault for not applying with the government. What government you talk about when they have no roads access to the nearest town? So these are real issue that maybe legislators in the Putrajaya doesn't know because you're far and they hardly visit Sabah, I think. I'm not accusing anyone, but it's true. Another area, just to tell you about what social protection in Sabah is, another area I visited after the MCO in June was a very famous area, tourist on the foot of Mount Kinabalu. These people planting vegetables, and during MCO not allowed to go out and sell the vegetables, the only livelihood they have. Apart from growing vegetables, they also run a homestay. And as you know, during MCO, there wasn't any tourists coming, and they're not allowed to anyway. So what if the government really cares about them? They should allow them or help them to market, because the only sector thriving during MCO was supermarket selling food. These people are producing food for the state, feeding people, but they are not giving priority. And I noticed during the MCO, the price of vegetables is supposed to go up, right? Because supposed to be shortage because no supply from the source. But no, the price is still there, partly because the control mechanism, another is because importation. So why should we import vegetables, the same vegetable people growing in Kundasang now, when we can buy it from our own people, and that help our own people? I'm not saying importing is no good. I'm for free trade, but it's a question of priority, life and death for the people. I think I hope I answer you, Ms. Ainun. Thank you.
Thank you. And yeah, if some questions when unanswered, do feel free to have post follow-up questions, which we'll get to if we have time. I actually realized we don't have the raise hand function. So Kelvin, can I invite you to present the next round of questions?
Yep, maybe I'll read out two more questions from the Q&A. Seems like we've got quite a few now. So first question from Dr. Idlan Zakaria. To all panelists, how could a job guarantee play a role in social protection systems in the future? That's the first question. The second question is from Raza Shazani, and she specifically asks Professor Dato' Norma. So Raza Shazani is interested to know more about Professor Dato' Norma's suggestions on how to tackle social protection issues in Malaysia, and she wants to know, she wants more elaboration on specifically how we can enable single window entry for all social protection benefits, and two, how we can use MyCard for benefits entitlement just as the existing universal healthcare. So maybe we'll do two questions first, and then we can, if we have time.
Okay, so maybe let's start with a question to Prof. Norma first. On the question on how to, sorry, Kelvin, I didn't catch that. The two questions, how to enable lower entry?
How to enable single window entry for all social protection benefits. And number two, on the use of MyCard for benefits entitlement.
Okay, I will do the single entry first. Yeah, thank you very much, Raza, for the questions. I propose a single entry window is simply because currently you have to go to so many different offices when you start work. Yeah, and even when you want to collect your benefits, you will have to go through so many windows too. So Dr. Amanina pointed out, thank you very much, I did not cover in my slides, that we have the Malaysian Social Protection Council. Yeah, it was established in 2016, and then the PH government revived it. The chair was the Deputy Prime Minister. They met once. Now the current one, Tan Sri Muhyiddin, revived the MySPC as well, in order to coordinate the different social protection programs. But the coordination is not done yet. It's still at the working level. So we are all involved in that. Hence, we are suggesting that it is to make it easier for individuals. So you were asking, how do we do that? We are not asking for all databases to be combined, no. But we are suggesting for an interoperable databases, that we share our databases. So can share. So using the IC, the whatever number that you have, if I go to one counter, the counter will be able to tell me, okay, you are entitled for so. So this is what you're entitled to, or for EPF, etc. So I see our MyCard is very powerful. Not many countries have this card until we use it. It's not powerful as a card, but it's got the potential. So I will come back to your, then it links to the question on whether, how do we use MyCard? Now, I agree with Amanina. We can't afford to give everyone perhaps now. Yeah, perhaps. But in my view, we can. In my view, we can. Provided it is not one program that you introduce, you will have to look at the whole program, the whole review. The government is doing the review now, yeah, under the different task forces as the components of the social protection, social assistance, social insurance, and the labor market policies. All three are working, but it doesn't happen. If it does, actually, it depends. If you want to give more, you cannot give everybody. But to do the wealth testing or asset testing is done in other countries, where it is already done now in Malaysia. When Prihatin funds were given, more people are covered under Prihatin as compared to the ASH, yeah? Because they use the LHDN data to remove the top 10% or 20% the top. And they also use the ICASI data to go and look for the poor people. Yeah, but somehow more people are in the or receive the benefits this time around from our research as well. So we do not have to give, let's say you're talking about child grant or you're talking about old age pension, you do not have to give to the top 70% if you don't want to. Yeah, because it's not only through LHDN, you can also go through the banks. If it is directed by the central bank, instructing all our commercial banks to say that we don't want to know whether how much they have, but give us the names of those with 1 million or 2 million and above. So those names automatically, if Norma Manso has 2 million in her bank account, if I go to a Kedai Runcit, I want to see whether I receive the Bantuan Orang Tua in my IC, it will not be there. So the proof that I'm eligible for that 400 ringgit or 300 ringgit is on the rich, not on the poor. So the problem is when it's not automatic, is that problem like Dr. James was saying, that they cannot register, and they live like 3 hours away or 100 kilometers away. So, but if you use my card, then it's automatic, meaning that if I have the my card, I just go to Kedai Runcit or whoever that has the reader or wherever, then I know, oh, I've got this month 350 or 400. And I'm going to touch upon Amanina's point on converting to annuity. This is what we are proposing as well, that the EPF should not be, as the World Bank call it, a half pillar. Yeah, it is a lump sum withdrawal. It is for savings. It is not a pension scheme. Yeah. So the only pension scheme we have in the country is the LTAT and the civil service pension. So the proposal is also to convert that so that individuals receive monthly allowance or monthly income as opposed to receiving one lump sum, or the BSH or the Prihatin is three payments or 2 payments. 1 payment is even worse, because we all know that among the low income, if they have the money, 1 lump sum, they cannot plan. Yeah, makes it difficult for them to plan on what they need. But if they know that monthly they are going to receive 400 ringgit or 350 ringgit, then they know how to manage their expenses. Yeah, so I think I have covered that, Terence. Yeah, thank you very much.
Okay, thank you, Prof. May I now pass to Dr. Amanina? Any comments on this?
Sure. No, those are all great points from Prof. Norma. I very much agree. And one thing that I would maybe like to mention also is that we've been talking a lot about the expenditure side, but we do need to be mindful also of the revenue side. And by that I mean, for example, going back to the question of UBI and the more developed countries, they collect a lot more tax, right? Their tax revenue is a lot higher, and so Malaysia's tax collection is actually pretty low, even for an upper middle income economy. And as we move towards becoming a high income economy, and especially if we are asking for all of these additional social protection expenditures, we have to also start thinking about where the revenue is going to come from. So to just quickly touch on that, but maybe I'll move on to the question on job guarantees, if that's okay. So thank you, Dr. Idlan, for that great question. Job guarantee is something that's very new in Malaysia. In some other countries, it's been done. Sometimes it's called public works programs. And Dr. Idlan, I believe, asked what is the role of job guarantees in a social protection system? I would say that there are several roles of job guarantee programs, and in the short term and in the immediate term, the role of this program would really be to support people who have lost their jobs. So if we think about the plans in Budget 2021 in Malaysia for a short-term job guarantee, the immediate effect would be really to provide people income while also giving them job experience. And I think this second part should not be overlooked, because as Prof. Norma mentioned earlier, one important role of a social protection system is promotion. And by promotion, we mean really encouraging people to be involved in productive employment. And what happens when you give people jobs, even in the short term, is that they gain working experience. And working experience is very important for them to be able to obtain a better job in the future. So if I could summarize, I think those are the two important roles for job guarantee programs. Although, of course, as with any other program, its performance would have to be monitored, and if necessary, the terms adjusted to improve this in order to support society more effectively. Thanks.
Yeah, and some good points there. I know social media is not the best source of information, but I see jokes posted about entry-level jobs needing 5 years of experience. But anyway, let me pass now to Dr. James Allen. If you have any comments on these two questions about the job guarantee, or if you want to comment about the use of my card for accessing social protection benefits.
Okay, thank you. Thank you, Mr. Idlan. Yes. About job guarantee, this actually can work if public sector, that is government, both federal and the state, willing to open jobs, government jobs. Like in India, if you drive on the street, you will see women mostly fixing the road. Unlikely here you see contractors with foreign workers fixing our road. So that actually example of public works that Dr. Amamina mentioned. So if taxpayer money willing to, we are willing to spend more taxpayer money to pay for their salary, it's like we recruit a lot of uniform, like military, civil defense. Those are actually part of that idea for the government to guarantee some sort of guarantee job for the people. That has socialism element in it, okay? Very socialistic. Communists took very extreme example by making sure 100% employment, by forcing people to become a farmer, or in putting in the concentration camp if they don't. So we are not going into that extreme, of course not. That is first question. So job guarantee require government, which actually has a monopoly to the power to coerce people, to force people to do things. Just like minimum wages implementation, it didn't really work that well, because minimum wages, one of the rationale behind minimum wages legislation was so some sort of guaranteeing not the job, but guaranteeing they get a decent pay. But the point is, I already mentioned just now, until September 2020, only 15,000 job vacancy in Saba, okay, not Malaysia. Malaysia got plenty because I already say Malaysia is at the full employment. More job vacancy than unemployed person in Malaysia. But Sabah is not. We are far from it. We are below. So from that 15,000 job vacancy, actually only 800 offered by both and state and federal government. The rest is from private sector. Are we allowing government to force this private sector to create a job or not? So these are not, it's not an easy yes or no questions. It has a lot of implication, unintended consequences. So I hope I answer you, Mr. Idlan.
Right, thank you very much.
Is the other question? I forgot.
Actually, since we're almost at 12, what I'm going to do is I'm going to ask, and we still have some questions, I'm going to ask Kelvin to try and summarize the remaining questions, and then I'll invite the panelists, Prof. Norma, Dr. Amanina, and Dr. James, to each give a very quick answer and or last final thoughts or that you want to leave with before we close the session. So Kelvin, can you just try and summarize the remaining questions? I know it's a big ask, and then the panelists will give their responses and or final thoughts.
Yep. So I've got a couple of questions about EPF. from Admin Go and Dr. Juita. So on EPF, one of the questions is, so recently there is the idea of having a tiered dividend payout system for the EPF, where those with lower retirement savings will receive a higher dividend payout rate. And Edwin wants to know what the panelists think about the suggestion. And the other EPF question is on the impact of EPF withdrawals on future savings of pensioners. So what other measures, was this a good measure, and what other measures could the government have taken apart from EPF withdrawals?
Right. So questions on EPF rates and withdrawals. And so now let me then pass first to Prof. Norma for any comments and thoughts, as well as your sort of final words.
Oh, okay, thank you. The EPF tiered dividend, well, it's a good idea. If you know, it's something that we can think about. There are two ways, I think, of addressing this. In some countries, they cap the contribution to the fund, yeah, but we don't. So you can go that way, or the other alternative will go for the tiered dividend. So if that is moving forward, if it's agreeable, that would be good. But I would extend another, what do you call that, to another level, which is to pay throughout as part of the annuity, part of the annual income, to annuitize part of the EPF contribution, part of the, not EPF contribution, part of the total sum, yeah? So if you reach a certain level, maybe you can take 1/3 of it, but I will agree with Amanina, the first thing that we have to do is to extend the withdrawal age. Currently it's 55. We can't even make it to 60. Yeah? Amanina suggested 65. We can make it to 65. I think that's very good. Yeah, because members can perhaps withdraw, because we've also done some actual work on this, can withdraw if the amount is beyond certain level that would guarantee a kind of pension after 65 or after 70. 1/3 of it perhaps for some, or a certain amount can be withdrawn as lump sum. Yeah. So that's my response to the first one. Number two is the EPF, the impact of EPF withdrawals. I think Amanina had touched that earlier, is the fact that already we are, the contribution has been reduced, and now from account 2, they are allowed to withdraw, and now from account 1, which is going to affect the old age pension, and it does help the household nevertheless. However, I think there are other policy options like soft loan, a cheaper loan, or free interest loan from BSN, from Bank Pertanian and all that, because I think even with Penjana, yeah, the Penjana 2.0, I know that some micro businesses, a real case, they miss Penjana 1 and go for Penjana 2. Even for Penjana 2, he didn't qualify, and according to the bank, that the income doesn't meet the level. So how do you? So who are you supporting? I mean, the income did not meet the level because they did not have any business during the MCO. I mean, they're affected. That's why they're applying. So generally, Malaysians they're not necessarily want free cash, but at least some easy loans, or free interest loan, or if you have to charge interest, maybe minimal interest for admin cost. So to me, these are some of the other policy options that we can look at. Now, there was a question earlier for my conclusion, Terence, that I saw in the Q&A section, is about zakat as part of the social protection. Indeed, when we were looking at the reform or social protection, review protection in the country, zakat should not be left out, because many Muslims pay the 2.5%, not just from their income, yeah? Because at least, I mean, in Malaysia, we don't tax the rich people other than the income tax. We don't tax their savings. We don't tax their ASB, AS, and you name it, we don't. Whereas with zakat, you have to pay. So I'm paying, yeah, into a zakat fund, which is about 2 or 3 billion for some states. So zakat would definitely have to come in, and also the state governments are also providing benefits, and NGOs. I mean, it's more difficult to bring in NGOs, I think, but definitely zakat. Although zakat is under state jurisdiction, we are not saying that we should be redistributing for that. No, but at least, like I said, with my card, if we have my card, then we know that someone who receives a wheelchair from zakat will not receive a wheelchair from so or will not receive a wheelchair from JKM. So it can be better distributed. Otherwise, one person has 3 wheelchairs, another one is without any. Yeah, so I will end there. Thank you, Terence.
Thank you so much, Prof. And yeah, definitely zakat as a element that we must not forget in this. Can I pass to now Dr. Amanina for any responses, comments, and last thoughts, please?
Thank you. Thank you, Terence. And since we ended on zakat, I will also start on zakat and make this blatant advertisement for you all to download the most recent Malaysia Economic Monitor, Surviving the Storm. So that was published in June, and that really talks about the social protection system in quite a comprehensive way. In my slides, I selected very few graphs from that report because there was too much in there. But one aspect that we did highlight in there is also on zakat, and we actually did we put in a graph of how much zakat goes in, and we talk about its role as part of social protection system, and I would encourage you to have a look at that. But to close, I think maybe a guiding factor as we go through this post-COVID economy or COVID economic recovery, some of the things to think about is that maybe we should really think about protecting while also encouraging productive employment, right? So we want to protect those who have been most affected, who are most vulnerable, but at the same time we acknowledge that right now it's not just the B20 who are suffering, for example. It's really a much bigger share of society, and so we want to protect as many people as we can, but at the same time really giving them avenues to take care of themselves, and by that I mean avenues to obtain skills that can obtain them to find better jobs, as well as facilitate job search and job matching as much as we can, and really the economy will only recover once people start spending again, and people will only spend once they have jobs again. And so this is really a gradual process, and encouraging employment, I think, is really important towards that recovery. Thank you.
Thank you so much, Dr. Amanina. And finally, Dr. James Allen, your thoughts and final remarks, please.
Okay, thank you. I would like to say that I don't really agree with the idea allowing people to withdraw from the EPF. The idea behind having EPF forcing people is to force people to save, because people themselves at the personal level cannot be trusted. When they have money, they are susceptible to temptation to spend it on something that is not essential. The very people who need withdrawal is the people who doesn't actually have enough to withdraw it. So who is withdrawing? The people who actually can live comfortably, but they withdraw for consumption which is not essential. How is it actually good? But of course, that's empirical questions. We need to look at it. As for investment, EPF actually, from the investment side, is not actually doing that well. I compare them with the return of investment on ASB. It's about give and take 3 to 4% per year. So with that ROI, you need 7% to double your income. If you have 7% ROI, you can double your income in 10 years. So if I now put my 1,000 ringgit, 10 years, it takes 10 years for me to make it 2,000. But it is not never 7%. It's only 3 or 4%. Don't forget, our inflation is also more than 3%. What you get in the end? That's why EPF is very crucial. It is forcing people to save, and they must not be allowed and given temptation to spend it on something unnecessary. Thank you.
Dr. James. Thank you, everyone. I do apologize that we have not been able to get to all of the questions, but I do hope that the ideas shared here has been informative and useful for you, and the discussion as well. As we move forward to try and get a good and comprehensive social protection system in Malaysia and recover from the COVID-19 as well. Let me thank the panelists, Prof. Norma, Dr. Manina, and Dr. James, and my co-moderator, Kelvin. Thank you all so much, and wishing everyone a happy New Year. And if we don't get to meet each other again, thank you all so much.
Thank you, and Merry Christmas and Happy New Year to all of you.
Thank you very much for having me. See you all.
Thank you. Bye.
Bye-bye.